I was expecting to see
No,
one.
nothing huge. Okay. Now, let me just take a quick look at all these other spots. Good. Okay. So this is a side view. This is you laying flat on your back. So if you're here, this is you looking like this. Okay. I'm just going to see if there's any narrowing of this canal here. That's pretty good. Yeah, so with your spine, there's arthritis in the spine.
Yeah.
So you can have arthritis in the joints. Okay. So we're in the actual bone part, but you can also have kind of degenerative changes of the discs, like what you're talking about. So when you hear it being talked about, we call it degenerative disc disease. Okay. You throw the disease at the end of any word, sounds terrible, right? So basically, in between the vertebrae, we have discs, right?
Yeah.
So we can see that here. You see this little white part here?
Yeah.
So that's probably a little bit of a disc protrusion. You call it a disc herniation, and it's actually very common. But what we want to make sure that there's enough space back in here. So it's a little bit tighter. But the nerves will usually be right along here. So even though you have a disc protrusion or a disc herniation there, it's probably too far to be pushing on the nerves. And then we can also tell that you have some, age-related degenerative changes. You see this black dot in here?
Yeah.
That's air. Okay. So usually it's white, and that's because there's fluid in that area. Usually there's like jelly and like a jelly-like substance. But as it deteriorates and kind of as we get older, sometimes we get little pockets of air, and that's just another sign
that I'm getting older.
Yeah, and that's what spines will do. The main thing we look at to see is, does it look like anything is really compressing
I see. Yeah.
So that looks nice and clean. When we look at the side view, so to see this little like white circle here, this is the nerve. So we were looking to see if this is getting compressed at all. So we can see that looks good there. You got a little bit of tightness here. You can see that white part here. But because there's a black area, that tells us it's not completely being compressed. Same thing here, that looks okay. We'll check the other side. We got a little bit of tightness in here, here. This is the nerve that we would expect to cause you some symptoms into your legs. So the thigh pain. Yeah, but those look okay actually. Yeah, so that one looks really good there. So I'm not really convinced that your leg pain is coming from your back. Okay, it could be muscle related. It could be related to the knees, but I'm really not convinced that any kind of treatment on the back would help with the leg pain. Okay. So in terms of so what's good is that you don't seem to have any severe nerve compression, which is a positive sign. And at this time, probably I think the best course of action would be to send you to the pain clinic again, okay? Because it worked and then it became less effective, but it's probably likely that when you had all these things going on with the prostate cancer and all, that may have been enough just to aggravate things and set things off. So the pain clinic could be quite helpful to try and decrease your pain, make them more manageable. Really, one of the things we want to make sure is that if someone has a history of prostate cancer, that you're not having any tumors on the spine. That happens sometimes. In this case, it looks okay. Okay. So that's one option. Pain clinic. Are you okay if I send a referral there and they can contact you?
Okay, that's here in Winnipeg, is it?
You live in So why are you here if you live in Saskatchewan?
Well, I'm
how's
just
that-
living in his house.
Oh, okay, yeah, yeah.
About, he asked me to come and live in his house for
Yeah,
a couple of
okay.
years, but that was 10.5 years ago.
Yeah, and you have a Manitoba health notice. That's right.
Yeah,
Yeah, it's usually it's either here or Pan Am. You don't really get to choose where you go. We just put
Yeah.
it in, and whichever one opens up first, they contact you.
you can't do it in Saskatchewan, eh?
No, I don't have any.
Yeah,
We don't have
okay.
any pull that way. If you have a family doctor, they can make the referral to Saskatchewan.
Yeah, that's what I'm.
Do you normally stay in Saskatchewan?
Yeah, and I can make it a day trip if I want to do it.